Hi, welcome to Socialpost Health Channel viewers. I am Dr. Chava Anjaneyulu, Chairman and Senior Consultant ENT Surgeon for Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is an advanced equipment for diagnosis and treatment of ear, nose, throat problems, snoring problem, voice problem, hearing problems. Nowadays, tinnitus symptom is becoming very common. Tinnitus, vertigo, hearing loss. Many cases of vertigo is due to the ear problems. In olden days, once vertigo comes, they think it is a neurological problem and there is a chance of stroke, bleeding or tumors in the brain. But nowadays, vertigo is mainly due to the inner ear pathology. If patient has vertigo, tinnitus, fullness in the ear, sometimes hearing loss, we can think this mainly due to the inner ear problem. Especially nowadays, sudden hearing loss are increasing. Many patients are coming with the problem of morning, I have sudden vertigo, decreased hearing, tinnitus, very dangerous. He feels very anxiety, apprehensive. He almost feels I am going to die. This is becoming more common mainly due to the increased viral infections in the atmosphere and increased obesity in the population, increased hyperlipidemia state, diabetic state, hypertension in the persons, and more exposure to the cold weather. Especially we are staying in ACs continuously in less temperatures that cause the constriction of the blood vessels. So viral infections, cold weather, along with the more use of phones, we are using continuously some exposure to noise mainly in the form of phones, headset, Bluetooth or continuous TV exposure. In olden days, we see maybe 20 minutes, 30 minutes, 1 hour. But nowadays, people are staying continuously in ACs along with the noise exposure. Many people, they are listening the TV also with the earpods. This continuous noise exposure and cold weather increase the risk of the sudden ear problems by constriction of the blood vessels in the ear and damage to the hair cells, that is the cochlear hair cells, vestibular hair cells and their supporting cells. So less blood supply and damage to the cells cause this vertigo, tinnitus. Whenever if you have sudden onset, if you contact immediately doctor, most of the times your hearing will come back, vertigo will subside, tinnitus also subside. If you delay the treatment more than 5 to 10 days, sometimes it is difficult to get back the nerves to the normal. Because continuous vasoconstriction for 5 to 7 days may cause permanent damage of the cochlear hair cells and vestibular hair cells. So sudden onset ear problems is easy to treat if we start treatment early and most of the times symptoms subside. So whenever you have the tinnitus, vertigo, hearing loss, suddenly get radiological investigations. Basically we call it as a stroke protocol along with the MRI of the temporal bone. If MRI shows normal, if we start immediately intratympanic decadron injections, most of the time tinnitus will subside, hearing improve, vertigo will come down. Mainly the problem comes with the chronic problems. If patient is having tinnitus, vertigo for more than 2 months, 3 months, if they attend the doctor after that, little bit difficult, but still nowadays platelet rich plasma injections are helping. If we give that injections into the ear, some patients, especially if there is no nerve damage, that we don't know before, only supporting cells damage, most of the time symptoms will subside. So either nerve damage happened or not, we know by treatment. If with the treatment patient condition improves, that means there is no nerve cells damage, supporting cells damage, those are recovered and patient symptoms subside. But it is better to take the chance of platelet rich plasma injections because there is no side effects. Patient will get benefit only if it happens. If you have any tinnitus, vertigo, dizziness problem, contact Asian ENT Care Center located in Panjagutta, Hyderabad. They will investigate you according to your problem, either cells damage, tumor, nerve damage. They will give the treatment, your tinnitus will come down. For further updates, subscribe Socialpost Health Channel YouTube.